Hello, my name is Raluca Turdean and I'm a third-year Cluj School of Public Health student. Today's presentation is about direct and indirect costs of diabetes. I will begin by presenting you the background of the problem, and then I will go on to the objective of this research. Furthermore, I will present you the methodology and results of this research. Lastly, I will discuss the limitations and future implications of this paper. Worldwide, 387 million people are suffering from diabetes. 77% of them are living in low and middle-income countries. By 2030, expenditures due to diabetes are estimated at $500 billion. In the United States, diabetes is the seventh leading cause of death, affecting almost 30 million people in 2012. In Europe, it is the fourth leading cause of death, with 31 million people diagnosed. Moreover, in 2011, almost 90 billion euros were put into diabetes treatment and management without accounting for indirect costs. Depression bears a great burden in terms of social costs, which in turn reflects on financial aspects in the society as a whole, but also on the individual. Major depressive disorder leads to lower levels of education, marital disruption, and lower employment rates. Moreover, it is associated with a wide range of chronic physical diseases, not only their onset, but also their persistence and severity. Depression affects approximately 350 million people worldwide. It accounts for almost 4% of all disability-adjusted life years and more than 8% of years lived with disability. Chronic illness is a non-risk factor for major depression. Moreover, mood disorders are most prevalent in diabetes as compared to other chronic illnesses. Some studies have shown that diabetes is a risk factor for depression. However, others have proven that depression is a risk factor for diabetes. Despite the unclear direction of the relationship between diabetes and depression, the negative impact of this comorbidity remains high. Existing comorbidity between diabetes and depression has been proven to lead to the lowest levels of quality of life as compared to other chronic illness comorbidities. Moreover, it has been shown that, on average, the comorbidity with depression has led to spending 516 euros more on healthcare yearly. One study found that patients with high-severity depression had significantly increased healthcare costs as compared to low-severity depression patients in terms of primary care, emergency care, or inpatient care. However, the greatest difference was in terms of mental health care. Overall, primary, ambulatory, and total healthcare costs were increasing directly proportional with the severity of the depression. This research is a secondary data analysis on a representative randomized sample from Cluj-Napoca. I started by filtering out those in the sample who did not report having positive costs. Furthermore, I ran frequencies on the remaining data. The descriptive data is shown in the following tables. In terms of age distribution, most of the study population was older than 60, only 1.1% were younger than 30 years old. Slightly more than 60% of the population was female. Romanian ethnicity was predominant with almost 80%. The majority of the population was married, while very few were cohabitating, were never married, or were divorced. More than 50% of the sample were working as blue collars, while 30% were professionals. Only 1% of the respondents declared having no education. Almost 50% graduated senior middle school, while 30% graduated junior middle school. In terms of monthly income, more than half of the sample earned between $200 and $400 monthly. The log-OLS regression showed that direct costs are decreased by age, gender, and the diagnosis of minor depression, but increased by the number of years since diagnostics. Thus, an elderly female with a diagnosis of minor depression will have significantly decreased direct costs of diabetes as compared to a mentally healthy young man. Indirect costs are decreased by Hungarian ethnicity, but increased by either minor or major depression. The total costs are decreased by age and Hungarian ethnicity. As expected, they are increased by the number of years since diagnosis and major depression. Minor depression led to decreased direct costs, thus contradicting the literature, and increased indirect costs, but had no significance in total costs, the two costs offsetting each other. What is most interesting is that gender, marital status, number of persons living with, education, and income level had no influence on either type of cost, despite the literature showing otherwise for each variable. What is intriguing about this research is the number of results that are contradicting the literature. The fact that minor depression leads to decreased direct costs needs to be further researched. Thank you very much for your attention.